Thank you so much for being with us this afternoon. Today we're going to be talking about behavioral and mental health in rural immigrant Latino families. First, let's go ahead and introduce ourselves. My name is Dr. Yumari Reese. I am an associate professor in the Department of Public Health. My areas of study really do focus on health and well-being of youth with a focus on Latinos. I also explore health disparities and intervention science and really kind of thinking about it from a positive as well as a risk framework. So looking at positive youth development as a way to think about not only what places kids' health at risk, but also what helps them thrive, overcome. Let me move out of the way.
Yep. Hi, everyone. I'm Zoe Taylor. I'm an associate professor in human development and family science, and my research area focuses on mental health and resilience in adolescents, primarily rural immigrant Latinos, which we'll be talking about today, as well as family strengths and positive youth development.
I think this moves. Oh, yeah. Okay. So today we're going to be touching on a number of different things. We're going to be touching on behavioral, providing also, just to make sure we're all sort of on the same place here, an overview of behavioral and mental health in rural immigrant Latino families. Then we're going to move on to discuss the project in which we'll be presenting some of the findings and some of the work that we've been doing, and that's the Purdue Puentes Project. There's a number of people here that really support the Purdue Puentes Project. It's not just us. It's obviously the families that participate, it's the funder, but if it's also the individuals themselves. And many of them are here in the front, and we want to thank you guys for being here. Then we're going to be talking about some of that work as related to behavioral health and mental health, implications for programs and policies. And we did want to leave plenty of time for questions and discussion in hopes of encouraging you to definitely engage in that. Okay, let's talk about behavioral and mental health in rural immigrant Latino families and provide an overview. As you heard this morning, 1 in 5 U.S. residents live in rural areas, and among them are racial, ethnic, and minority groups. The reality is that most research on racial and ethnic minorities focus primarily on urban and metropolitan areas. And there are rural settings that have very distinct challenges, as our speakers and panelists talked about this morning, right? There's low wage work, there's labor-intensive job, there's limited transportation and health and educational services. Rural settings do experience higher child poverty and lower educational attainment. Now, if we were to focus in on Latino families, these challenges are compounded by fewer bilingual services and culturally relevant resources, as well as limited social support, the social support that you might get from the richness of having cultural enclaves in your area, for instance, compared to what you might find if you were in an area like New York, which would have a large Latino population, so established urban Latino communities. Also, families experience acculturation, a stress between maintaining your own cultural values, your own cultural beliefs and practices, and then engaging in the practice of now you're in a new host environment, and what does that stress mean, both for you as an adult, but also for kids. And they may experience prejudice and discrimination. And as you can imagine, these intersecting challenges create very unique health and developmental risks for rural minority youth, and yet they remain very understudied in the fields of public health and developmental science. So let's talk a little bit about this migration. So what we've seen since the 1990s is that we're seeing a shift in migration patterns. So historically, migration was in these areas like Texas, California, Florida. But we're seeing a shift to more Midwestern areas, even Southeast areas. Now, a lot of migration occurred for economic demands or for economic reasons. Now we're seeing, not only are we seeing a shift from migrants moving to these non-traditional migrant areas, but we're also seeing people who are coming not necessarily for economic reasons. They're coming because they're fleeing their country of origin due to violence, for instance. Now, we want to keep in mind that when families are relocating, they are also moving with their migration history. So it isn't that they are here, and now they're in the U.S., and everything that they experienced in their country of origin is gone. All of this are lived experiences that they carry with them. So our work in particular focuses on rural Latino youth from migrant agricultural families, and these families present very distinct challenges. So youth in farm worker families are a subpopulation of Latinos, and because many of them move in search of seasonal work, they experience high mobility. They also experience, as I mentioned, these acculturation stresses. Many face extreme poverty, live in substandard housing conditions, and they are in rural areas which are already geographically isolating, but many within these isolated areas experience marginalization. Because some of the families are moving in search of crops or seasonal work, they don't align necessarily with the academic calendar. So some may need to leave earlier in May, which then impacts the youth because they may miss out on all of the finals, those finals exams, which impact their educational outcomes. So it places them at educational disadvantages. Another thing is as they move, now they're in a new area where the educational requirements in this new area may not match the educational requirements in a previous area, which also puts them at educational disadvantages. Studies, including our work, has demonstrated that these youth are experiencing mental health problems. And many of the kids, and we're going to be talking about some of the voices of the kids in the stories that they shared, many of them are workers themselves. So they're working, so it's not only the families that are moving in search of work, but they move with their families and they engage in agricultural work. And so they're exposed to the occupational risks that agricultural workplaces, adults as well, so them as young workers experience those risks, those health risks. So now taking a step back, if we were to look nationally at what are the challenges that, the health challenges that Latino adolescents face, well, one, adolescents are experiencing health challenges related to mental health. Now, if we were looking at Latinos, just in this chart over here, sorry, I should be pointing. By the time I find the pointer, I'll need to move on. But what you see here is just in Latinos, the past year, among Hispanic adolescents aged 12 to 17 in 2022, 1 in 5, or almost 20% Hispanic adolescents had a major depressive disorder in just the past year. And 3 in 4, about 76% of Hispanic adolescents with major depressive disorders had severe impairment. We're also seeing sort of like a comorbidity where substance use by major depressive disorder in these vulnerable populations. So what you're seeing in the chart up above is that Hispanic adolescents who had a major depressive disorder in the past year were more likely to use substances. Now, this particular one, except opioid and misuse, but they were more likely at risk for using substance use in the past year or past month than Hispanic adolescents who did not have a major depressive disorder. Okay, with that, I'm going to pass it on to my colleague.
I don't know if we can do a little pointy.
Pointy has got to be something super simple, probably that.
Yeah.
There it is. It had a green mark, super simple.
Okay, so our data comes from the Purdue Puentes project. This is a 3-wave longitudinal study that began, we were funded right when COVID hit, not to be recommended at all, not a good time to start a major project in the midst of a pandemic. But so we collected data from 2021 to 2025, and we originally had started with this farm worker population. Because of challenges, because of the COVID pandemic, we actually expanded our data collection to include rural Latino youth and their families as well. So we have a mixture of different types of families in our data. So we've ended up with 307 families with youth between the ages of 10 and 15 and a primary caregiver. We did not specify it had to be mom or it had to be a dad. This is often whichever primary caregiver was most available. Often it's hard to get parents to participate, and this has worked really well for us in terms of retention. We were funded by, I don't know if we said our funding, we were funded by the National Institute on Minority Health Disparities. So overall, our study aimed to look at challenges, but most importantly, we really wanted to take a strength-based approach. Both Yamari and I are interested, as we both mentioned, in positive youth development, resilience, and strength, and these families are often studied from a deficit perspective. So we really wanted to identify sources of resilience that go across these families that promote health as well as educational outcomes, which are very critical to success and positive well-being. So here is our sort of demographics. As you can see, we were sort of evenly split with boys and girls. Majority are two-parent families, but we do have a significant number of single-parent families here. And most families, the primary caregiver did participate. It wasn't required, but most did participate. This is a sort of an immigrant population. Most of the caregivers, 94%, were first-generation immigrants, and a good percentage of the kids themselves were actually immigrants as well. So almost a third, 29%. As Yamari noted in the beginning, the population that has been coming to the Midwest is different and has probably changed across the U.S. in general. We often study Mexican origin families, but the population here actually has shifted with a lot of families coming from Central America. So you see here that a lot of the youth, the predominant group for our first generation kids are actually from Guatemala and then Mexico, but also we have a large number of groups from El Salvador. Most of the parents are Mexican origin. About a third of the kids came from a migrant education program. So these are farm worker families who had been integrated into this program, which is a national program. The socioeconomic status is very low, as you can see. Most families have a very low income, and most parents have a low educational background, and their healthcare access is pretty mixed. So even the kids themselves, almost a quarter of them, parents are reporting that they don't have access to healthcare, and 56.4% of parents don't have healthcare either. This is a community sample, so families were recruited through extension, through schools, through the migrant education program, through a lot of hard work, going to a lot of different places. And we, thanks to a lot of our team members sitting right here, we've managed to keep families engaged in the project. And so with Wave 3, we've ended up with about 87% of our families still participating. In terms of what we've collected, we have traditional surveys for both primary caregiver and a youth. We have them do behavioral tasks on an iPad, so they do executive functioning tasks. We've collected education data from the Department of Education. They do biometrics, so they have their height and weight taken so that we can look at BMI and their blood pressure. And then we do one-on-one interviews with a subsample of both youth and moms, which we'll be bringing up today as well. And that all of this data has been longitudinal, including the interviews. All right, so we're going to talk about behavioral health first.
Thank you. I'm just going to time myself. Okay. So today I'm going to talk about parent-youth substance use communication, or just communicating about substance use. Do parents do it? In particular, the parents that are in rural Latino agricultural families. Okay. As I mentioned earlier, early substance use in Latinos is a massive problem. So we know that adolescents overdose deaths are alarmingly rising. Overdose is now the third leading cause of death for youth under the age of 20. Fentanyl, particularly, has become a dominant factor, jumping to contribute to nearly two-thirds of such deaths among adolescents. In rural areas, the context is even more pressing, with higher rates of opioid misuse and often limited prevention infrastructure. This underscores the urgency of culturally informed, family-based prevention strategies in rural Latino communities. Why does this matter for rural Latino youth? Well, first, as we've already talked about, rural Latino youth, they experience or they face these compounding structural vulnerabilities. Now, research that has been done, while it's limited, has found that if you create prevention programs that are culturally sensitive, that it can actually reduce substance use in young people and in Latino adolescents. But the promotion of these programs, in particular in rural areas, are not existent or very low. So, however, public funding for rural prevention efforts often lacks cultural responsiveness and flexibility to reach agricultural and mobile farm worker families. Our study addressed a critical gap. We asked how Latino parents and youth in rural agricultural families communicate about substance use and how these conversations are shaped by Latino cultural values. In particular, two values, respeto and personalismo, as well as how do structural conditions such as migration, rurality, and community risks, how do they impact parent communication about substance use. We use social cognitive theory to explain how these conversations might shape youth behaviors, and then intersectionality to situate them in the lived experience of structural disadvantage. A little bit about social cognitive theory, which is freaking out my students right now who are currently in my theories class, but that's okay. Social cognitive theory, if you really want to kind of think about it, it provides us a roadmap. It provides us a roadmap to sort of understand how parent communication might influence youth substance use behaviors. And so if you kind of think about this in the way, this example is what this theory argues is that parents can actually enhance a kid's sense of capacity by just providing them some skills, teaching them some learning skills like refusal skills. Parents can also be incredibly influential in how kids imagine the expectations might be if they engage in substance use. So a kid might imagine that engaging in substance use is cool if that's their expectation of it. But if parents really reinforce negative consequences, that can actually influence how kids might view substance use or their engagement of substance use. Parents can also foster what's called self-efficacy or confidence. They can foster confidence in young people to resist peer pressure as well as risky environments. Now, learning can come from parents, but learning can also come from just observing as we witness, especially young people, as they witness their environment, as they witness important people in their life, they're learning what behaviors they should engage in, not engage in, and it helps in terms of their decision-making process. What is particularly interesting about social cognitive theory is this idea of reciprocal determinism. Reciprocal determinism actually argues that it's not just about the parent influencing the youth, but that actually youth can influence their own environment. They can influence parents. The next framework that we included in this study is intersectionality. Intersectionality allows us to see how overlapping identities like being a Latino, being an immigrant, living in a rural area, being from a low-income family, or being low-income might shape families' lived experiences. So parents' communication is not only about behavior, but it is framed by structural disadvantage. So living in a rural poverty area, accessing under-resourced schools, and having limited health services is going to influence not only what you communicate as a parent, but how you might communicate it. Also, as I mentioned earlier, mobility or migration across agricultural labor or markets disrupts continuity. So moving from one place to another might disrupt the support that a young person has or a family might have or prevention efforts that they might have. But also, your migration history travels with you as well. So whatever you experienced before you came to your host country is coming with you, and it influences the way you view things. Cultural values, or Latino cultural values, two important values that have been found to be considered relatively important in Latino families and that parents want to pass on to their kids is this idea of respeto. Respeto is the idea of teaching kids to respect authority figures or to defer to their parents. And personalismo reflects this idea of wanting to create with your young person a warm relationship that has trust and closeness. And then finally, this idea of experiencing trauma in your life, trauma that might come from exposure to violence, that might come from just witnessing or being exposed to substance use, or just trauma in terms of watching overdoses in a community. So the idea here is that communication is not only about behavior, but it's framed with this structural disadvantage and at the same time the cultural values, and it guides how risk is then communicated. So it tells us how or what might influence how families approach communication. With that in mind, this study proposes the following: that neither social cognitive theory nor intersectionality alone is actually sufficient to explain parent communication about substance use. Because social cognitive theory is going to explain how family communicates at a behavioral level, but intersectionality, again, is at this outer level. So this study is trying to integrate these two frameworks. Really, so in other words, it helps us not only see how parents teach refusal skills, as you see in the center where social cognitive theory is, how the parents might emphasize outcomes or build self-efficacy, but they don't do this in isolation. So these families are embedded in migration histories, rural economies, and cultural values like respeto and personalismo. So by combining social cognitive theory and intersectionality, we're going to capture not only how communication works, but also why it takes place or how it's shaped. So what you see on the outside is those structural factors, and then the lines are showing how those outside structural factors could be in creating pressure or force on the individual behavioral level. Okay, so what did we do? We used a subsample, as Zoe mentioned earlier. We used the interviews for this particular study. We interviewed 47 youth between the ages of 10 and 15. About half of them were girls. Most were farm worker or from farm worker families, and about 53% were U.S. born. 20 mothers of the total population engaged in an interview, participated in an interview. The average age was about 38 years. Most were foreign born, most were from Mexico. Most lived in the US about 5.8 years, and most did not complete high school, and the majority were married. Again, the median annual household income, it was about 30 to 40%. The kinds of questions we asked, for the young people, we asked them, have your parents talked to you about tobacco, alcohol, or drugs? Describe this to me. What did they say? Was there a situation that brought this up? Did they or you bring this up? And for parents, we asked, do you talk to your child about risky behaviors such as smoking or drinking alcohol? What rules do you have about these behaviors or activities? And then we used thematic analysis to analyze the data using in vivo 15, and we did both using inductive and deductive analysis. What does that mean? It just meant that first we just looked at the data without any theoretical framework in mind and just looked to see if anything naturally emerged from the data. And then we took our data and we began to map it onto these theoretical frameworks, the social cognitive theory and intersectionality. In total, we found 6 themes. So I want to talk a little bit about those themes and what do they reflect from the voices of those who participated. So let me start by reading Josefina's point. So Josefina, a mother, she says, if someone offers you alcohol or cigarettes, you just say no, no thank you, and walk away. You don't have to explain yourself to anyone. So here you see a parent who's teaching refusal and avoidance strategies, and this very much maps to social cognitive behavioral capacity. They're trying to teach the kid how to refuse and also give him confidence. Just walk away, say no, walk away. What's interesting here from Josefina is the polite way of refusal, which really does reflect that cultural respeto. Be polite. Don't break any relationships. Just say, no, thank you, and walk away. I love that they said thank you. I just think that that hits. The other thing here is you see the parents' awareness that there is in their community the likelihood that the child is going to be exposed to an offer. And so they're doing this ahead of time, like they're giving the talk ahead of time. So that awareness of these rural risks also does, and it's like a trauma-informed vigilance. I know that this is likely to happen, so let me just protect them ahead of time. So now let's talk about Gilberto. Gilberto says, when I was in Louisiana, I was on a bike and somebody asked me if I wanted some substances. I was like, no. And then I went to my mom and I told her what happened. She was like, never say yes to that. Tobacco, alcohol, and drugs. This demonstrates not only the kids' ability to engage and enact and refusal skills. So those conversations about say no, here we're seeing Gilberto actually in life saying no, but we're also seeing something else. Who does he come back to talk to? He talks to his mom. So that idea of personalismo, that trust, and also what is very interesting is that reciprocal determinism. What did I say earlier? I said it's not just about the kid is this empty vessel. The mom, the parent tells you, and the kid doesn't have any influence on the mom. No, quite the opposite. What happens here? The kid, this happens to the kid goes home, he tells the mom, and in telling the mom, he triggers a conversation where the mom then talks to the kid, so he's influencing the mom, and then the mom takes the opportunity to continue to reinforce those messages of say no. The next theme was like warnings, openness, honesty, intersect with cultural values and structural environments. I want to read Susanna. Susanna is right here. Susanna says, I'm very open about telling them things like they are. I know that they are going to go to school and they're going to see drugs. I try to tell them that those things are never going to lead him to anything good in life. I hope God gives him the wisdom to say no. I'm not saying that friends force you to do things because nobody forces you. I always tell them that they are responsible for their own actions because they have the right to say no. So here the parent is conveying health, academic, and life risks. They're giving, hey, if you engage in this, this is trying to shape the young person's expectations of what it would be like if they engage in this behavior. Up at the top, Louisa, I love Louisa. She very succinctly said, if you do that, I will punish you. Bam. So she's reinforcing that respeto, that authority, that accountability. Now, what you see here is, if you look at Louisa, I am open. I talk to him. I want to share this. I want to tell him. So again, it's this openness, honesty. It's sort of fostering that warmth, that trust relationship between mother and child, right? Now let's look at the kids. So Yesenia, who's a 12-year-old female, what does she say? She says, I say that it's true what my parents say because substance use is bad. It can kill us. It can make us sick. And then Joaquin says, I know it's my decision if I want to use or not. And both of them, what they're saying is they're both expressing, not both, Yesenia is expressing that their parents are seen as credible sources. So there's this trust that's been established there. And then also, they're showing that they have acknowledged their own self-efficacy, their own confidence. I have agency here. I can make a decision. Now, what you can see here when we go back to Susanna, in particular, where she says they're going to go to school and they're going to see drugs, is this sense of this is inevitable. So again, these messages are shaped by these structural risks, the messages that the parents or the reasons that they're communicating. You and I may communicate to our kids because we think, hey, this is what we are doing. But this parent is communicating based on observed risks in their community. So they're saying from their own trauma exposure, the school's exposure to substances, I have to do this. This is something that's happening. Theme 3 is talking about learning through witnessing substance use communications in the context of trauma. Here, Gabriela says, a niece overdosed. She was 17 when that happened to her. It's ugly, and I have talked to everyone about the consequences of doing drugs. And then Maritza says she saw her daughter. She saw a lot of her sister's drug addiction, and I say it helped her, and I say sometimes it didn't help her either, because it wasn't a good example for her. So here you see parents actually using losses to teach their youth. Again, it's observational and vicarious learning. In other words, I'm going to teach you by learning from others, but what I use to teach you is trauma. So showing how structural disadvantage, high community exposure to substance use, and tragedies really kind of force parents to use this trauma as a prevention tool. Let's look at Nina. She says, my dad used to do like drinking and smoking, but he quit all of that. So here you see that disclosures of parental recovery, like watching your parents not only once be using, but then quitting, could actually build relationship trust. It could also, you can see that youth are absorbing knowledge and that they are also both knowledge and trauma from these contexts. So what do I mean by trauma? You could imagine that family instability when the drinking was happening, when it was problematic. So the idea that kids can absorb both knowledge from observing, but also they can absorb from the context in which they're living. Atonia says, in my country, I saw kids smoking and getting high. My dad always told me, no, no, no. And if you want to have a good future, then don't do it. And I've never done it, never smoked. I've never drank alcohol or anything like that. So here's a great example of this migration history and how it actually informed their own behavior for substances. They bring that with them, right? So you being exposed to peer use, watching that vicarious learning, it showed how mobility and exposure across borders shape substance use communication and their own prevention. But again, seeing other young people as a young person is a traumatic experience for that young person. And I'm not saying that they said, this is a traumatic experience, but what I mean by that when I say trauma is these are experiences that are quite harsh that kids are going through in their normal day-to-day life. So prevention is not just individual skill building, it's influenced by culture, trauma as well. Next, I want to just talk about what happens when there's contradictions. So do as I say, not as I do. So here Enrique says, like my dad drinks alcohol, he told me not to do it, focus because I'm young, so I might get addicted to it. Sometimes he gets drunk, so we just want to leave him on the couch so he'll go to sleep. I worry about him because he's been drinking like mostly his whole life. So it makes me like sad for him, but I feel bad because like I feel like not doing it, not talking to him about it. And then Paloma says, in Mexico, if there was a bottle of beer or something like that, a kid tries it, nothing is going to happen to the kid. So yeah, sometimes I would ask my dad or my mom, and they would give it to me. So here would be some contradictions between what a parent advises and the behavior. So it could undermine those processes like outcome expectations. Think about it. You're telling them all the negative things that could happen, and then you're engaging in the behavior, and the kid will be like, I guess it isn't that bad. Or you are saying, don't do it. Oh, but you can do it in certain circumstances. So this is a contradiction that could actually impact those values of respeto. So can you respect the authority figure that is telling you one thing and doing another? Or personalismo. Can I trust do I feel trust? Also, I want to highlight that youth reported sadness, worry, and discomfort, and they also reported that this contradiction also impacted their want to go and talk to youth about it. So parental substance use. One last thing I wanted to note about this is this idea of the parent drinking all of his life. Now, I have not interviewed the parents, so I can't say this, but we could potentially draw from that could be a coping mechanism for the parents, that could be coming from living in poverty, experience marginalization, and just migration stress. The next is very interesting. Many of them used media to actually talk about these things, to trigger conversations. So here, Adriana said, a mother said, my baby boy always comes to watch the news and he shares with me, Mommy, this happened in such and such a place. Take advantage of it. I take advantage of it and explain to him with more detail. He likes to be informed. And Marisol says, we were watching a show and my mom just said, if you guys have issues, talk to me. And if you guys ever do drugs, then I'm going to send you to an army base. So here what you see is that learning from others can go beyond the family. It could be what you see in the community, overdoses in the community. It could also be this media can actually act as triggers for parent and youth dialogue. It also gives parents an opportunity to reinforce their rules and consequences, that idea of respeto. It gives parents an opportunity to have warm conversations. It allowed the kid to prompt some of these conversations as well. Of course, the downside is relying on media can limit what kind of information is provided, so it could actually dilute the effectiveness of the conversation. And then the last one is just the parents who said, no, I don't actually talk about it. I don't discuss substance use or focus on general, and if I ever do, I talk about it just in general in terms of morals. So here's an example where Leonor says, no, I haven't sat down to talk to him, but I always try to tell him that he should never take something that is not his and not lie. And so oftentimes the parents, when we're asked, well, why don't you talk, or is there a reason, they said they felt uncomfortable, or they believed that the youth was way too young. And many of the kids confirmed this. So we asked them, did your parents talk to you? And they just flat out said no. So silence may reflect respeto. It may be that the parents are trying to respect the youth's innocence. It could also mean that they're trying to preserve family harmony, like don't want to cause trouble. But it could also be trauma, where the parents just don't want to talk about something that is very traumatizing for them or recall painful experiences. It does represent a missed opportunity where parents could reinforce all of the factors that could help with decision making for the young person. And youth may actually, if they sit in silence, they may turn to less reliable sources like their peers and or media. So what are the overall findings? Communication, in summary, family communication does reflect social cognitive processes, but it's deeply shaped by cultural values and structural realities. Importantly, youth are active participants. They confirm, they enact, and sometimes reshape these conversations. So these findings highlight not only the importance of prevention approaches, where we work with young people by helping parents and their ability to engage in these conversations that can be very uncomfortable for many, but that when we do these prevention approaches, it's not just solely individual skills, but that we should incorporate within them elements of cultural and structural context. So as we've seen, substance use prevention among rural Latino youth can't be understood outside of the family, cultural, and structural context. But behavioral health is only part of the picture. To complete the story, we're going to turn to mental health with Dr. Zoe Taylor, who's going to share findings from how structural stressors like immigration, politics, and discrimination affect families, and importantly, how family communication influences youth awareness and agency, and how resilience is maintained through community cohesion and family support.
Okay, so we're going to switch to some mental health findings, and I'm going to sort of provide a snapshot of some of the work that we've been doing that is focused on mental health in the families. This is focused on both youth and parents, so a lot of my work situates mental health within families. We know that the well-being of caregivers impacts how they parent and how children's outcomes as well. So first, of course, we're putting this in the framework of rural populations. So as Yamari mentioned earlier, we know that rural youth have specific vulnerabilities in terms of being growing up in rural communities, and that rural Latino youth do have elevated levels of depression, anxiety, and psychological stress, and particular suicidality. This is kind of combined with lower access to resources that may help them, right? So medical care or other resources that they may need to help them with mental health. We see that that national services, surveys like the YRBS provide broad kind of snapshots of Latino youth, but studies that focus on rural youth show that there are specific things that exacerbate mental health, such as marginalization in the community, geographic isolation, limited providers. You may not have a psychiatrist or someone to help either at the school or anywhere, cultural stigma, and then structural inequities. So I'm going to start by presenting a study that was done, that was published in Cultural Diversity and Ethnic Minority Psychology, and this looks complicated, and so I'll sort of work through here. This is based on the family stress model, and essentially the family stress model here. I should stay here and see if I can do this. So essentially, the family stress model starts here with economic pressure impacting family functioning. So economic pressure is detrimental to families through its impact on increasing psychological stress in caregivers, and that can impact relationships. So in particular, it increases interparental conflict if these are married, and how people parent. This in turn, of course, causes more detrimental outcomes for kids. So we wanted to see, as we mentioned, then this study was begun in the context of COVID. We're also in a rural community and in an immigrant population. So there are a lot of structural inequalities that are linked to both economic pressure and to other psychological things like psychological distress in parents. So we kind of expanded this model. And as you can see here, what we found was that things like discrimination both were linked to all these other experiences. So stresses often snowball. So these were stresses often that co-occurred. So high impact from COVID, high reports of discrimination, and also acculturation stresses. So these immigration experiences were things like language hassles or other stresses, sort of acculturating to a community. And they were linked both to feelings of economic pressure and psychological distress. Switching over to a paper that is under review right now. That first paper, we didn't focus really on any resilience, but this paper that was done by one of our postdocs was looking at the impact of cohesion. So thinking about how, alternatively, what happens if neighborhoods feel cohesive, if they're a source of support for caregivers. So again, the focus here is still on caregivers and their well-being and things that may buffer. Sorry, now I'm going way too far. Okay. That may buffer mental health. So this is looking at neighborhood cohesion, and as you can see, neighborhood cohesion reduced mental health problems, and that in turn increased parenting behaviors, positive parenting behaviors. So we can see again how external environment are things that may benefit youth as well in terms of the neighborhood they're living in, both in positive and negative ways. The study that I want to spend more time on is one that is preliminary that we're just conducting right now. So right now, we have finished sort of with our official 3 waves of data, and we have our grant under review to renew the study. But because of everything that's happening right now with Latino families, and we're not collecting data actively, we decided this summer to conduct some interviews with some of the families so we could just kind of take the pulse and see what's happening. And kudos to Marie and Clayton and Genesis who have gone out and collected data, because I've listened to these interviews and they're hard. They're really hard. So we know, of course, that the current immigration policies that are being implemented are having very significant impacts on Latino communities, whether you're documented or undocumented, whole communities. And of course, a lot of families, including our families, are mixed status. So a number of kids may be documented and their parents might not be. Parents may have mixed status as well, and siblings may, right? So within a family, you have a lot of different status as well. Prior research, of course, there's probably more research that's going to come out, but prior research from the last Trump administration really showed a lot of negative impacts on psychological stress, mental health problems, and other detrimental impacts from these increased enforcement efforts. So right now, and again, this is sort of preliminary, so you get the initial one here, is that we're looking at how families are doing in this context. And this was a new question that we added to our interview protocol to see how this current climate is impacting them. So we interviewed 20 youth and 20 moms this summer. So we actually just finished, thank you, Clayton, our last interview last week. And so we have about half our families were the farm worker families who we've been working with in the past, and 10 of them are new families who are rural families but not necessarily involved with the MEP. Our kids are older now than they were when we first started the project, so the youth here are 14 to 17. Half of them are girls, and in this group, about 21% were immigrants. So the majority of them are US-born youth. And this is the question that we focused on today. There's a lot in the news and on social media about immigration, racism, politics, and how Latino families are treated in the US. Do your parents discuss these things with you? How do these conversations make you feel? And separately, we'd ask them, what are some of the things you fear for your family? Did you have a question?
The students that were the Fuentes Project students that were US born, did you track whether or not they were a mixed family, as in some of their family members weren't documented?
Yeah, good question. So the question was whether we tracked whether family members were documented. This is a really tough question for researchers. We made the decision in the very beginning not to directly ask families whether they were documented or undocumented. Some of them shared, and I'm not presenting data that we have because in some of our interviews we do have migration stories. So a number of our kids talk about their migration stories, and they talk about traveling, they talk about crossing rivers, and so we can infer some of their statuses from that. Other times we can use measures like whether someone has a driver's license. It's not really exact, but we did not want to, and we don't want to endanger our families, and they put a lot of trust in us with their data and sharing their stories, and so we really try to protect their, what they tell us as much as possible. So yeah. But every single kid, and I've listened to all 20 of the interviews and what they replied to this question, all families are sort of having this, what I call the talk. And, there is no kid here who's unaware, obviously, of what is happening and has described some sort of impact on it. So here are two of the quotes that sort of represent some of what the families are talking about, and I'll just let you read it. So, this is representative of someone here who may not be documented, born in El Salvador, and also someone who is born here in the U.S., right? But their stories are very similar, right? In terms of worry that they're going to lose their parents and the sadness here that they have.
As we've learned, sometimes people are getting picked up and they don't even ask questions.
Yes, and they know that. So these kids are seeing a lot here, and this is why this story. This girl here is, she says it's sad to hear that people that are like you are being taken away. So, and at any moment it could be you or your family. So there's a lot of stress. There's a lot of anticipatory stress that's happening. And one of the big themes that really was very predominant was, of course, people are worried about their families and being separated, but in particular, people are mentioning dads. So here are two quotes also, and I've bolded some of the ones here. Dads, in particular, seem to be more vulnerable. Moms seem to be at home more, and so kids are maybe not as concerned. They're probably also seeing the news where it seems more men who are being detained. We're not quite sure, but over and over it really is concerns about dads. And again, these are different kids from what we just had before, because really this goes across all of the kids. I could probably have provided examples for all of them here. And this is both of these youth are U.S. citizens. So I'll let you just read these two. Okay. There were a number of things that youth described that seemed to sort of suggest that their behaviors are changing because of what is happening. So this boy, born in Guatemala, he said he described this as sort of like being in another lockdown because of people staying home and not going out again. So people staying home, and then here ends. I guess you never know when's the last day with someone. So I'll let you read this one. Another boy who says, they're just really careful. They make sure they obey the laws so that they don't get into trouble. And then this girl who isn't describing something that happened to herself, but talking about gossip that happened in schools. So a lot of the families in the study are from rural communities in Indiana, small rural communities, and so of course people do know one another. And here she's talking about an 18-year-old whose parents were deported, and then she is left and is trying to take care of her siblings, and she didn't know how to because she still went to school and stuff, and it was stressful for her, and I felt really bad for her. So of course, feeling empathy and concern for other people, even though it might not be happening to you, knowing this is happening in your community as well. There is optimism here. We want to focus on resilience, and this is a really hard topic, but the kids themselves did express optimism and resilience. So this boy, in his interview, he was talking about worried about his dad because his dad didn't have his driver's license, and so worried about him getting stopped. But he says, but hopefully he gets his license soon, and we don't have to worry about it. We see here another boy who's talking about his parents telling him it will be okay. There's a chance we could get papers to be here, so then we won't have to worry. And then he talks about the sort of this idea that he has, this very optimistic idea about going to school. If I graduate, I can go to college and I could get a good job here. And if I'm lucky, I could get my papers and even be able to travel to my home country to see family members, and then come back here and work and live here and have a great life. And so again, some optimism that we're seeing amidst a lot of this stress and sadness. And then a number of kids who say they feel sad or worried, but sort of feeling like nothing will happen to them or their families, like this girl. The last theme is really thinking about how parents really support their kids. And we do have the mom interviews here as well that get asked the same question. The mom interviews are mostly in Spanish, so we have not had a chance to really look into those yet. But we'll be able to see what kind of information parents are talking about and providing to their kids, and do something similar like to what Yumari talked about with substance use. But here we see that there is support being provided, and the kids are going to their parents for this reassurance and support. So again, this boy here, 17, he's talking about people being too scared to go out, sort of similar to the kid who was talking about a lockdown, too scared to get groceries and stuff, it makes me feel like not sad or stressed, but I get that feeling in my gut when I hear it. But then when my parents talk to me, I'm like, okay, I calm down and that feeling goes away. And so nice feeling of going to parents for support here. And here, my mom had a little chat with me. She said, you know, it's tough if it happens, but if it does happen, you just have to push through it. I was a little nervous about it, but the conversation gave me a better understanding. Kind of a sad quote too, but again, there's communication that's happening and reassurance here as well. And then the last one here, they don't really talk about it. They say it will be okay. I kind of felt worried because I thought it would make a big change or something, but my mom was like, it won't make a big change. So again, reassurance here from this kid. So overall, in terms of, like I said, these are preliminary findings, but we're finding that youth are acutely aware of what is happening. They're seeing this on social media. We do ask them where they get their information from, and a lot about TikTok and the usual suspects in terms of social media. They're seeing the videos, right? They know about places. A lot of them talked about immigration and ICE being in their neighborhoods, and the center in Indianapolis that is the detention center that is coming to Indianapolis. So they're very aware of what is going on. And there's a lot of stress, anxiety, and concern. But as I said, there's also optimism, hopes, right? And their conversations with parents are really important, both for open communication and also for helping them kind of deal with their concerns. I'll just sort of note here that about a quarter of them, when we asked the question, did say, this doesn't really impact me. They, like this kid, to us it's not that big of a deal, but to others it is definitely. So this sort of represented, they are still very aware, and every youth still went on to talk about the impact that it was having on their community, even if they felt that they would be okay themselves. All right, so we'll quickly do, we'll talk about some implications. And here, I'll just start by saying, a lot of these are structural stresses that we've talked about today, and we know that they're detrimental to relationships in the family, and behavioral and mental health, and adjustment of all members in the family. And so interventions and preventions can work on coping strategies that would be implemented with families in culturally relevant and sensitive ways. That can be done with the whole family, because this, of course, is what's important to Latino families, and what we've reflected here. Families are close-knit, they talk, and having family-level interventions are what's really critically needed here. Extension programming here could be a place that would be really great. We work with Extension, and they've been wonderful partners to this project, and also a support to families in these communities.
Next is just really kind of thinking about family as a critical source of support for adolescents, as you've seen from both of these studies, both in their behavioral and mental health. But how do we utilize trusted partnerships like using community health workers or promotoras that could help enable or support families, or families that are having difficulty or facing barriers to resources? These trusted resources could actually help facilitate their access to those resources. Another thing another implication is this idea of like telehealth models that can connect families to resources, especially in these isolated areas. Telehealth models can actually actually link people to resources that aren't located in the local area, but that they could provide them those resources, support groups, any kind of mental health resources, or earlier in terms of parental education resources.
And I'll just piggyback on that too, that telehealth may be especially critical now where families are scared to go places, right? So having that ability to be safe and get support is probably really critical. Using a strength-based lens is really important. There's so many challenges, and we've presented a lot of challenges and vulnerabilities in families, but both Yamari and I are dedicated across our work to using a strength-based lens for the youth and families that we work with, and across our team, and we have a lot of different people working with us. We do a lot of different work. That this is our model that we use, and I just sort of wanted to highlight that we do a lot of resilience. There's a lot of great work being done by collaborators on pro-social behavior, which of course is really important in adolescence, and really important to look at right now. Also things like civic engagement, supportive relationships. I think our talk today really showed the value of supportive relationships, and especially family relationships here. Focusing on flourishing, not just on problems, is really important, and thinking about resiliency and other strength-based traits that may be able to be implemented in prevention and intervention work. So we're hoping to contribute in that way.
And then finally, kind of thinking about, so, okay, advocates like yourselves, how could you actually provide assistance to families and inform policies, right? So one of these things, as earlier was discussed, there's going to be cuts to these FQHCs, or federally qualified health centers. So advocating on behalf of not of those cuts, because those are critical for individuals who are living in rural settings. Also, access to migrant health centers, making sure that they are not eliminated, but that they continue. Also, advocates can engage in work to really kind of highlight the need to invest in mobile health and telehealth models. Again, as Zoe said, both for rural population in general, but for these families in particular, the importance of being able to connect them to the resources that they need, and in rural areas they unfortunately do not have. Also, expanding the workforce and prevention infrastructure. We need to work on mitigating some of these structural and legal barriers, and advocates will really be helpful in doing that, necessary in doing that. We need to promote worker advocate partnerships. Again, a lot of these individuals are farm workers themselves, both the kids and the families, and really advocating for their rights as farm workers, their protection, their health protection, their rights overall. Policy change. One small example of policy change is that youth can actually engage in our, agricultural work as early as 10, but that's only in agricultural work. No other area can kids as that young actually engage in working, but yet working in the fields, it's acceptable. So policy needed, and then ultimately we need to expand, as was spoke this morning. We have these FQHCs, and they were small numbers to begin with. What we needed was to expand. Now we're losing them, so we need to maintain them, but ideally actually work to expand them.
Okay, and we've acknowledged the families and the youth and families who have really shared their stories with us. We are, so thankful to have been able to do this work, and for their continued participation. Our team, we've worked with a variety of different people. We've had so many great graduate students and undergraduate students who have made this possible. We would not have been able to do this work without their help collecting data, and our project manager and project assistants who are over here, and of course our funding as well. And we'll just open this up for sort of questions and discussion. Both of our emails are here, so you're welcome to contact us with any questions if you're interested in the study or anything that we're doing. But please ask questions. We'll start here. Yeah.
So I work in, my name is Neil Redell. I work in Delphi School Corporation. And I'm one of two social workers, and then my focus is mental health, so I'm actually the mental health specialist there. So my question, I guess, is Delphi is predominantly white, but we have a very strong Latino, Hispanic population in Delphi, and about 10% of our student body is made up by Hispanic Latino students. So my question for you is, as someone who's obviously a white woman, and then unfortunately our staff does not look like many of our students, and then considering the cultural components, the mental health conversation with those students and families is a difficult one to have to even initiate, right? So I guess, do you have any kind of pointers, any suggestions, I don't know, just somewhere to begin that conversation, while of course being sensitive to the different components, and then the obvious ones of I'm a white woman talking to this Latino family, and I want to be considerate of that too. You know what I mean? So, yeah.
Yeah. Anything with mental health, I think it's really important that people feel safe, and so I do. So, we have a team of people. We try and match people by age and by, and of course, people's language, right? So as much as we can, when we're interviewing youth, a lot of our graduate students are the ones who do the interviews or have done in the past, because that is sort of the demographic, right? And that's where some of the relating are going to happen, and so. I also have done work with single moms, and so when I've done interviews with single moms, with the older single moms, then I've done that work, and then when they've been younger single moms, some of the grad students have done that work. So I'll think about sort of what the needs are. If you're limited on resources, it becomes very tricky, because is something that isn't quite right better than nothing? Probably, but we're really advocating for sort of culturally sensitive support that needs to happen, and so having people who look like you, who are familiar with your language. This population also, I should say, we have a number of families who don't really speak Spanish or English proficiently, and you may be seeing that in some of the schools as well. Some of the families from Guatemala, their native tongue is not Spanish. It's an indigenous language, and so we've also sort of struggled with this even within our team, that has a lot of different cultures, because we think Spanish, but even within our team we have people from Brazil, from Mexico, from Colombia, so we have a lot of different types of Spanish speakers. But yeah, but do you want to say something, Mary?
Does this work? Does this work?
No.
Okay.
Here,
And I think you
speaking
can
to her, because
I think here's one of the things. First of all, your compassion and your want is critical. But I would say, are there community partners that you could actually partner with? Is there, like the Migrant Education Program, they try to provide, they are Spanish speaking, they understand the mental health issues that these young people face. Is there a partnership that can be developed there that actually brings your school and these organizations together? And again, here's where that difficulty is with, like, maybe perhaps that community partner is not there in Delphi, but maybe it's in West Lafayette. So is there a way that you could actually bring in the families, do use internet if that's a possibility? Of course, we have to worry about the confidentiality and all of those factors, but your compassion is important. Being able to provide anything that is as close to culturally sensitive as possible. You can't do it. That's understandable, but there are resources available. How can you tap into those? And I think participating in this kind of symposiums is another way to do that, right? Because a lot of people in this room are offering those kinds of services in different parts. So that'd be one thing. Extension. I don't know if there's an extension person nearby that might speak Spanish as well, so I didn't mean to. Tessa in the back.
Share a bit more about your decision-making process for focusing on mother caregivers specifically as opposed to some other caregivers in these families, and if that's something that in the future, if you could just speak on that a little bit further, I'd love to hear more.
So we focused on mother caregivers in the interviews mostly, but for the broader study, the requirement is that it was a youth between 10 and 15 and a primary caregiver. And so that could be either mother or father. Predominantly, we have moms who have participated in terms of providing the survey. I can't think of the number off the top of my head, but we do have dads. So in the renewal, we do actually want to get both parents if present. So the focus on moms for the interviews is we did a sort of a limited number of interviews, and we would have needed to have equal number of dads participate as well. This becomes a little more challenging. Dads are less likely to participate across research, not just with Latino populations, but across the board. We also found that dads are often work later hours in this sample in particular, so moms are often more willing to participate. But this is a limitation of our work, that we're not getting dads' voices. We would like to get dads' voices, and hopefully if the study is renewed, we'll be able to do that. So moms, I think as you see from the interviews, though, our research has sort of shown that moms are a really critical source. People are close to both parents, but moms do seem to be a particular sort of hub of resilience for these youth.
And I, just if I can add to Tessa's point, and I don't know if you were kind of alluding to this, but of course in Latino families, there's the extended family, the importance of the extended family. And I just want to highlight that that is one of the limitations. We are focused on the mother. We're hoping to bring in the father. We haven't moved out to the extended family. But if that's sort of where you were going, yes, I agree that they're also incredibly influential in supporting their young individuals in their household. But we did not do that.
Thank you for sharing, and I appreciate that your research has a significant importance on the significance of the parent family system. But I'm curious about what if the family system just break down? And this current situation or the responsibility that should have been taken by the government, the state, is missing. So it means that more responsibilities are being taken by the families, but actually they may be overburdened. They may not be competent enough to deal with all the risks, the structural barriers. So if the family system collapses, they didn't function well, what will happen to the outcomes of the adolescents? Because I had the class with Dr. Ray in the last semester, I still remember clearly that one child said, do you want to have a family when you grow up? And the child replied that I don't want to have a family because I prefer to have a dog. So what have you thought about the negative effect of the family system?
Yeah, so It's a big question, but a couple of things. I mean, my work is focused on resilience for a long time, and I love thinking about resilience because it seems very hopeful for work to focus on challenges that people kind of overcome. But there has been a lot of focus recently on the idea of like who is being asked to be resilient and what's the burden of being sort of asked to be resilient to a lot of these things. And for example, the paper that I presented first is really focused on structural stresses, right, that are overburdening families. Now we can look at things that may help with this, right, but ultimately it's policy that needs to help support families and make it so that families aren't experiencing these kinds of stresses. Sometimes it feels like you're beating your head into a wall because this is nothing new in terms of saying poverty is detrimental to families. I mean, this is work that has been going on for decades and decades and decades and decades. We know that, right? So policymakers have to make those decisions. But in the meantime, we as researchers have to sort of try and figure out how to make our work reasonable for families in a way that doesn't stigmatize them, doesn't overburden them, and doesn't put the onus on them to be, overly resilient to things that they shouldn't be experiencing. The studies that I presented, no kid who's 14, 15, 16, 17 should have to be thinking about these things. Like, it's very clear to me, right? It's absolutely heartbreaking, and it's also just disgusting that some of these things are having to be worried about at this age, right? But we want to be able to, one, document it and then see like how people are coping with this very traumatic experience, right? And families are strong. So yes, there's a lot of things that I think can break down in families, and the family stress model itself is actually quite a negative model. It's sort of talking about the snowballing effects. So thinking about ways that we can intervene to stop some of these stresses, I think is really important, and hopefully can be implemented. But it's a hard situation.
I just want to say I appreciate that question so much, because from my study you can see how just that parent and that having that conversation really does shape the young person's view of substance use, and is a buffer, is a protector. If you remove that protector and then what you add in its place is more stress, right? So that's going to increase their risks of substance use and all other kinds of elements. So thank you for asking that question. What does it mean when the family is not there to buffer? And your response. So what do we need in order to keep that family in place?
Yeah.
Dr. Reese, Dr. Taylor, thank you for sharing this. You guys have shared some of the implications that this political contest has had in like the Latino communities or like the migrant communities. We still have to see the long-term effect that these have on the families and the communities. So what can we do more on the community level, or like also on the individual level, to offset these implications that we have? Like trying to keep in mind more of a proactive approach rather than a reactive approach, because for me, like we are, it's already too late. So how can we do something to prevent things or offset a little bit the implications that we have, as we've seen already, like trauma, like fear, and how that also implicates changes our behaviors in like in migrant communities here.
Can I just start? I mean, one of the, I would say, and again, I'm going to point to the conversation. So we can think about this in multiple levels, right? So one is making sure that families are aware of the resources that are available to them. So as Zach Zamara pointed out, there's legal resources, and there's also ignorance about what is available and what they can do, what can they not do, how can they protect themselves, what can they do, right? So how could we connect them to those resources that are actually out on the ground providing those services to the families? But then it's almost like you were planted, right? So what are those structural resources that are protecting our families? How can they say, what are they doing in the school system? What are they doing in the hospitals? What are they doing? Like, how could we make sure that those entities are not only supporting their families, but engaging in advocacy, right? So you have a voice. How can we use that voice in a really difficult climate, right? So there are ways to be able to use your voice in a non-confrontational way. And I think that there are people who are and organizations that are very keen and know how to do that. So so I would just say, one is protecting the families. They should, as Zoe said, having them protect themselves at this particular moment is not an option. Protecting themselves, standing up for themselves, they will be placing themselves and their families at risk. So how could we actually step in and be that voice?
Yeah, and I would just say, we can advocate, and I think we can give voice to people who are not able to give their voices. So, the last study that I presented, we've just collected we literally, like I said, just finished this data collection, but I'm really hoping to move forward very quickly with this data, which we wouldn't do, because it's so important. Because when you read what these kids are saying, you feel it much more than if I just presented a chart that said, 100% of them are experiencing concern about their families, and put it into a bar graph, right? And I could have done something like that, but it doesn't have the same impact as when you actually read what the kids are saying in their own voices, right? Which is, the real beauty of qualitative work. And so you can tell the stories. You can write to your senators and the people who represent people here to tell people what you think about what's happening in your state, right? In either way, right? Whatever you feel like, right? But and advocate for your views in that way. But for me, I feel like being able to present stories of people is how we sort of think about moving forward. So.
Unfortunately, this is the last one before we can.
I was just curious if you have asked, or if you have plans to ask youth what some of their ideas are for how they like some of these challenges that they face to be addressed, either kind of at the individual family level or also the structural level. Have you done any kind of that brainstorming with the youth, or had that come out maybe naturally without probing?
So
The questions.
yeah, I have to think about that.
We do ask, like this question, that this is one of the questions in the interview, and we do ask them, Clayton and Maria probably remember because they've done a lot of the interviews, but we ask them, what's the change, what is the change that they would like to see, or
Next year.
in their community?
On the community, yes, we do. They do share that they expect some change to be done, although some of them do not believe that a change is going to be made. But you can see that they share with us, some of them shared with us that they really want to change, and they're willing to try. Although they're very young, they say, with our age, I don't know if we can do much, but yes.
I'm so glad you just said that. One of the things we talked about in the data, and you see them being aware of mobilizing efforts that are happening. So they're talking about it. There was the one kiddo that was like talked about where there was a march, blah, blah, blah. So they're aware of that. But that isn't actually answering your question, because your question is, did we ask them, well, what would you do so if I was to tell me, I'm going to paraphrase. Are you asking, did you ask them, what would you do to make this safe for our families? Is that sort of what you're asking, or?
That can be one component of it. Just like in general, are you doing brainstorming or like solution generation with the youth themselves, or getting their ideas for how they would want the challenges to be addressed? kind of at any
Yeah.
of those levels.
We do. I think we will have some of that. We do ask them, like, do you think that people in power care about kids like you? And that could be any definition. So we've had kids talk about the mayor in their community, or people who'll talk about, the federal government, or they'll talk about the governor of another state, right? And so some of it obviously is like who they're sort of seeing. Some of them on social media. Some of them are more involved in their communities. So they're referring to people who they're actually involved with there as well. We also ask them about their community, and we ask them not just sort of about their fears for their family, but their hopes for their family. And so we haven't looked at that data yet, but that will be a piece of this as well, in terms of, and I imagine a lot of those hopes for family will be sort of thinking about what they might do in the future as well.
So, and we ask them in terms of community, we ask them if they believe that they can create change, and in which way do they believe that they can create change. So that's where we're asking them in terms of, because we're trying to understand civic engagement and what role they believe they have, or what role they believe civic engagement might have. So that's a great question.
Yeah.